Hello and welcome. My name's Lee Karim. I'm one of the teacher practitioners in the pharmacy department. In this session, we're going to look at consultation skills. So the aim of the session is to introduce you to the key consultation skills needed to ensure you have effective, confident communication with patients and deliver high-quality, patient-centered consultations. What are the learning outcomes for this session? So it's to describe and learn the key skills, models, techniques that support patient-centered approach to consultation skills. And describe and learn the components of history taking and identify tools that will help you explore the patient's knowledge and understand their concerns during a consultation process. So what does consultation or a consultation mean? It means it's a meeting to discuss something or give advice with the goal of discovering the best course of action for that person or persons to take. To do this, we like to use what we call a person-centered approach. What we want to do is move away from one-way conversations or the old style of consultations where you're just telling the patient or the person what to do. I don't know, maybe you guys are too young to remember, but in the old days, even doctors would just talk to the patient and saying, this is what I want you to do. We want to move away from that. The focus is now to reach a diagnosis based on the patient's individual needs in partnership with the patient, taking on board the patient's perspective. So it's basically a two-way process, and we need to adapt our questions in order to do this effectively. So a key component in person-centered approach is listening. So you listen carefully to the patient, adapt your responses so that your response is more person-centered. And it's about shared decision making. So even the NHS now realizes that there's got to be equity and excellence. And there's the saying that there's no decision about me without me. So that is an ethos that we would like to develop. So you're actually engaging the patient in the process, giving them some ownership in the decision-making process, and they will take more responsibility for their healthcare, which, as you will see, leads to better outcomes. There's evidence to show that when we do this, there's a greater potential to improve the patient's outcomes. It boosts their satisfaction with the service they receive. It increases their knowledge and understanding of their health. And importantly, it increases adherence to a chosen treatment. And it brings significant cost reductions, because if you think about it, if the patient is happy, they've understood, they have felt listened to, they have felt they're part of the process, then they're more likely to take that medication. So if they've purchased it or you've sold it to them, they're not going to take it, so it's a waste of their money. If it's something the NHS has supplied, and because the consultation wasn't a good consultation and they weren't really happy, they were unsure, and they still don't take it, then it's a waste of NHS money. So not only does it benefit the patient, it benefits the NHS as a whole. So when do these sort of things happen? When do consultations happen? If you think about it, they happen all the time. You consult people on a personal level, but as pharmacists in a professional level, they happen in community pharmacy, they happen in hospital pharmacy. So examples in a community pharmacy is when you're doing an over-the-counter sale. If you're responding to symptoms, if they've come in and said, oh, I've got a cough. Or it could be that you're cancelling them on a new medication they've been prescribed on their prescription and you're handing it out. Could be when you're doing a new medicine service, which is something that pharmacists are asked to do, where if patients put on a new medication, you see how they're doing periodically, you check that they're happy for you to check on them to see if they've got any questions or concerns, and you check in a week or 2 weeks' time, see how they're getting on with their medication. So that's another area where you need good consultation skills. You could be doing a medicine use review. These are all things that you'll learn later on in your course. You could be doing a supply of emergency hormonal contraception. So you need to be able to gather the right information to give the right advice to make the right supply. You could be a smoking cessation advisor, something that I used to do. So by having an effective consultation, you'll know that you've gathered the right information to be able to recommend to them the right nicotine replacement therapy product. So these are all examples in community pharmacy. What about hospitals? Well, in hospitals, you will learn and you'll have placements on this sort of thing, so it'll make more sense later. You do what we call a medicine reconciliation. So you're reconciling the medication the patient should be on when they're admitted based on what's on the drug chart. And part of that process is that you need to take a drug history. A drug history involves going to see the patient and asking them about their medication. And you'll learn later, you'll actually have practice placements where you'll see pharmacists do this and you'll practice yourselves how to do this. So that's another example of a consultation in a hospital setting. You could just be providing information about the medicine. The patient may ring you, even when you're in hospital, because they've gone home with a medication and they've got a question. In my hospital pharmacy, we always put a sticker on the TTO bag or the bag of medications the patient takes home to say that if you've got any questions or concerns about the medication, please ring the pharmacy. So they may ring you and ask you. You could be helping or even running an outpatient clinic. You could be visiting the patient in their own home. You could be going to a care home. These are all scenarios and examples of where you'll be doing patient consultations. How long does it take, you might ask? Well, that can vary. It can take a few minutes, 5 minutes, 10 minutes. It can take half an hour, maybe longer. It depends entirely on the type of consultation and what you're discovering in the consultation. Make every consultation count. If you think about it, that is when you're having a consultation, that is your opportunity to make a difference. It's your time to help. It may be a small time, you may only have 5 minutes, but you might have told the patient something really important. If it was an antibiotic, you telling them that this is flucloxacillin, you need to take it an hour before food, will ensure that they take it properly and therefore they will recover from their infection. If you didn't say that, you didn't stress that, maybe they won't read the label. They just know they have to take it 4 times a day. They might take it with food in the middle of a meal. So it's about making every consultation count. Although it's a small time you have, the impact can be quite big and quite important in improving the outcome and the health of that patient. There are different types of models, evidence-based models, on how to do consultations. They're all evidence-based, and you may learn some of the other ones later on in your course. But for this session, we're going to concentrate on the Calgary-Cambridge model. We may touch on and look at some of the other ones briefly, but essentially we'll concentrate on the Calgary-Cambridge model. Other models include the BARD model, where you're looking at behavior and it kind of stresses that humour is quite important. It still stresses about the aims of having a shared agenda. Your environment or the room is important, and dialogue, how you speak to the patient, your body language, your tone are important as well. There's another model called the neighbour model. We'll have a look at that briefly in a moment. So in the neighbour model, there, if you get your fingers out, fingers and thumbs, you can see the main points discussed on there. So in the neighbour model, it's about doing good housekeeping, connecting with the patient, summarising, doing a good handover, and having a safety net. So housekeeping is focusing not on just the patient, but looking after yourself as well. Make sure you've had a break. Make sure you're not rushing into the consultation. If you had a bad experience and you're just about to go into the consultation, maybe you need to take 5 to, calm yourself down, get yourself back together before you just launch straight into the consultation. About connecting, it's about building relationships with the patient. Summarising what you've told the patient, seeing if they've understood. Handover is talking about documents. You may need to give the patient a patient information leaflet. You may signpost them. You may tell them a good website or a good charity that they could contact. So you might want to provide that information. You might write it out for them. You might print off the information. Safety netting, that's important as well. That's about aspects of the consultation, having a safe closure, allowing them to feel comfortable that they're able to return to you, say if something doesn't go right, or they forget something, or then they think of a further question, they can come back to you. You might want to say to them, if this doesn't help in a week or so, come back to me, let me know. So, or where to go next. Another well-known technique, some of you may have heard of it before or come across it before, is health coaching. It's very well known and well-researched technique. The acronym can be remembered by, once again, on the fingers of one hand, fingers and thumbs of one hand under the acronym TGROW. So if we use the example of somebody that wants to lose weight, so the topic you might say, so what can I help you with today? What would you like to talk about? So they would say losing weight. You would then go on to find out what their goal is. What do they want to achieve? And the goal might be that they want to lose 5 kilograms in 2 months. Then you look at the reality, how realistic is it, looking at their lifestyle factors, what sort of work they do, what could be done, how could they fit in an exercise regime or a diet regime. That also would come under options. What are their options moving forward? You could just say, well, the first step is, that you need to do this. Or you could ask, what options have they tried already to lose weight? And you want to establish the willpower, how much will they have? What do they want to do next? How do they want to do it? What do they need from you in able to be able to do it? So you can do some CPD on that. You can research that some more if you like. Some people do courses, a couple of days courses on it. It's a very specialized field, but you might be interested in looking it up further. So if you know you're going to have a consultation, what you should also do before you initiate the consultation is do some preparation. So some pre-consultation preparation. You need to make sure your knowledge is up to date. You might want to use resources. Make sure you've got a BNF to hand. You need to consider the environment. Check the consultation room is suitable. It's away from interruptions. You're probably going to offer the patient a seat. Make sure that there is actually a chair in the consultation room. You need to think about yourself. Consider how you're going to get into the right frame of mind to prepare yourself for the consultation. Complete other tasks or put some tasks aside so that you can concentrate on your consultation. So you can focus your attention on it. You might want to read the patient's notes before the consultation. You might, if you're working in a community pharmacy, you want to check their PMR before you go into the consultation. Remember, during the consultation, you want to give the patient your undivided attention when the consultation starts. So if we just pause here for a moment and recap on what we've looked at so far. So we've looked at the different tools we have and the different models that there are or that we have. And remember, for this course and in pharmacy, we're going to concentrate on the Calgary-Cambridge model. So remember, for pharmacy, the key model that we're going to use and concentrate on is the Cambridge-Calgary model. It has a very structured approach and functions in a stepwise fashion, sequential fashion, which helps provide an effective structure to build a relationship with your patient so that you have a very effective consultation. So the steps include initiating the session, gathering information, physical information, explaining and planning, and closing the session. We're going to go through each of these steps in more detail. So, first one is initiating the session. So what's that about? That's about how you start off. What do you begin with? So that's like, hello, my name is. It's about the greeting. And that you might think, oh yeah, what's the big deal? But that is quite important. Hello is a very neutral, simple term, but you have to think about these things. If you were doing a consultation and you said good morning or good afternoon, it might not be a good morning or a good afternoon for that patient. They may have had some bad news. They may have just been told they've got cancer or they've got a real bad illness. That's why that they have to go on to this very harsh treatment. So, you just say good morning, and they might be like, well, it's not actually a good morning for me. So you have to think about these things. So hello is a good term to use to start with. And then obviously introduce yourself, your role, and the nature of the consultation. You might need to obtain consent depending on the situation. And again, depending on the situation, you might need to check the patient's details, check their identity. If you were on a hospital ward, you would double check that you've got the right patient. You would check their name, their date of birth. If you were just selling paracetamol and they were asking for a painkiller, you wouldn't want necessarily to know their name and date of birth. But you would want to establish somehow the reason for the consultation, what the patient's problem is, what the issues are, why they've come to speak to you, or why are you having this consultation. Try and use open questions rather than closed questions. Questions like, hi, after you mentioned your name, and what would you like to discuss today? Or what questions were you hoping to get answered today? How can I help you? So it's kind of like, it helps also to set boundaries. It's negotiating, it sort of like helps negotiate a shared agenda, the purpose of the consultation. If it's it may be the case that you're not going to be able to discuss everything in that one consultation. So you might say, okay, so today we can discuss this, and then later on or tomorrow, or you can come back. What we'll do is discuss their other issues. So agenda setting is quite important in itself. It reduces uncertainty. It allows for more effective use of time. You may only have 5-10 minutes or half an hour. You may have prescriptions to check. So it kind of maximizes the time that you have together. The patient can raise concerns. You can identify what's the most important issue that they can discuss at the very onset, and the other issues you can explain that you can address later. And again, it's about encouraging a negotiation and having a mutual partnership between yourself and the patient. And like I said, prioritizing the problem. If there's lots of problems, I mean, if you think about it, GPs, when you go and see a GP, you may already know this, that they have 10-minute consultations. So they will only give you 10 minutes to discuss one problem. If you want to discuss more than one, they'll say you need to book a double appointment. So these are factors that we need to consider. Agenda setting also helps build a good relationship between yourself and your patient. Builds a rapport, helps the patient feel that they're understood and valued. Part of building the relationship is having a good professional approach, being confident, friendly, as well as competent. You have to look for non-verbal communications, body language, appropriate eye contact. Remember, you have to be sensitive too. For some people, it may not be appropriate to make eye contact. It may be culturally insensitive. So these are the sort of things you've got to pick up on. If the patient's continually staring at their watch, it might be that they've got a bus to catch or the time's running out on their meter. So you can, broach these subjects. You need to look at your body language as well as theirs. You need to pick up on non-verbal cues about things like the eye contact. Like I said, it's about developing a rapport. Part of developing a rapport is avoiding being judgmental. We all have our own biases and our own judgments, but you have to respect those of your patient. You need to avoid using medical jargon, fancy words, because they won't mean much to the patient, and they may hinder your consultation or make it a less effective consultation because you're going to use fancy terms that the patient doesn't understand. Even if you explain them, it's just better to just use simple language or language appropriate to the patient that you have. You need to show empathy and support, and be supportive and be sensitive. You might need to see, they might say they have a rash, but you need to ask. You can't just say, right, well, I want to see the rash or I need to see the rash. You need to ask, is it possible for me to have a look at the rash? Where is it? It may be in an area that the person doesn't want to show you because of their own sensitivities. So you need to broach the subjects carefully. These are all things that will come with time. I'm sure you will develop these skills as we go on, but this is just to remind you that these are the sort of things you need to consider, especially how you're going to involve the patient. Again, sharing what your thoughts are, providing the rationale for your thoughts. If you think that this is the issue, why you think that that's the issue, and why you've gone for this particular treatment. And again, examination, you need to consider about whether you need to examine the patient and what that would involve. Do you need a chaperone? Does the patient need a chaperone? These are all things you need to consider. I wonder how you're finding the Calorie-Cambridge model so far. The more we go through it, as we go through the observational guide, the more you'll become familiar with it and the more you'll appreciate how it flows, and it will start making more sense. So we've done initiating the session. So the next step is gathering the information. Now, a big part of that is history taking. 80% of diagnosis is through history taking. You'll learn more about history taking in some of your other sessions and later on in your undergraduate course, especially in your hospital placements, but we will touch on it here as well. So history taking is a process, and there's different stages to it and different parts to it. There's looking at the presenting complaint, looking at the history of the presenting complaint, the past medical history, the drug history, the family history, and the social and personal history. Now, all of these have factors or have influences and important points that you would gather to help you in your consultation. So the presenting complaint, obviously you'll learn about what's the issue, what symptom have they come in with, how long have they had it, what type of sputum is, what type of colour is the sputum. These are all things that you would want to know as part of the presenting complaint. There's the history of the presenting complaint. That's important as well. How long have they had it? That may have a factor on what you would suggest. The past medical history, that's an important factor as well. It could have an impact on the symptoms and what they can and can't take. So they may have asthma, they may have inhalers, so maybe their asthma is getting worse or they're not using their inhalers properly. You may want to ask, maybe if you were working in a hospital setting, or then do a peak flow. So these are important bits that you would gather from the past medical history. You would do a drug history, which is part of taking history. The drug history is looking at what other medication they take. There may be an interaction with something that you were thinking of suggesting they could try. You may interact with some of the medication that they take already. You want to know the nature of their problem, and you want to know their allergies, which is part of the drug history process, because you want to know how severe is that allergy. What is the allergy that they've had to a particular medication or food? Is it a rash? That again would have a factor on what you may or may not suggest. Family history can also be relevant in certain situations. Again, you would learn that later on. Social and personal history. Again, that's important. But it could be something simple, even something like, do they smoke? How much alcohol do they consume? What sort of work do they do? They maybe work somewhere where they've been working with asbestos. That would mean that they need to be referred for further tests. All these sort of things take time and take practice, which you will get throughout your course and your time here. Remember, diagnosis is very important. Nowadays, as pharmacists, we're expected to be able to do that, to be able to diagnose certain conditions so that we can offer effective treatments. And it's a skill that you will develop over time. So part of the information gathering process, you want to explore the problem. You want to encourage the patient to tell you about it in their own words. Try to establish the sequence of events, like when it started, how, when it got worse. We have something called the golden minute, especially at the very beginning, when you should allow the patient to speak uninterrupted. There are lots of different techniques, and you'll learn these as you go. Some of you may know already if you've worked in community pharmacies before. There's a well-known one called the 2 WHAM technique. So W as in who is it for, the second W, what are the symptoms, H, how long have they had it, action they've taken already to try and resolve it, what medication they're on. There's TED, tell, explain, describe. Tell, again, is focusing on the practitioner, focusing on yourself. Explain, it maybe is a better way when you say, can you explain to me what the issue is, what the problem is? Can you describe it to me? Those are more open-ended questions. And you tend to get, just as a tip, you tend to get more information out of someone when you use open-ended questions. Another one that you'll probably come across, especially when you do responding to symptoms, I'll just briefly mention it here, and it's part of looking at the history of a presenting complaint. Is another acronym is Socrates, stands for the site where the infection, onset, character, radiation, how does it spread, what are the associated symptoms, timing, when did it first appear, what makes it worse, what exacerbates it, and how severe it is. As I say, you'll learn more on that when you do your responding to symptoms. Another important aspect of gathering information, or a technique, is responding to the cues that you receive and acknowledging the patient's emotion. We say listening is not just about using your ears, you listen with your eyes. Yet another acronym that can help with that is something called rasa. Now rasa in Sanskrit means juice or essence. So the acronym rasa stands for receiving. R for receiving. Receiving the patient is about paying attention to the person, showing that you're paying attention rather than looking around or looking at your watch or something else that might be happening. Gazing away. Appreciating what the patient's A is for appreciating what the patient is saying. You could make sounds to acknowledge that you understand. Yes, things like that. So the patient realizes that you do appreciate what they're saying and you are acknowledging it. Summarize, S for summarize or paraphrase. You could sort of paraphrase what the patient's told you in your own words to show that you have understood or to check that you've understood what they're trying to tell you. You can ask them to clarify something at the end. If you're not sure, you could say, just to clarify, so what you're saying to me or what you're telling me is. So that's another one that you can use. There's also something we call ICE or LICE-F. It's about looking at things from the patient's perspective. Remember, patients, when they come and see you, they have their own agenda, and it's about establishing what their agenda is, what their ideas are. If we look at the example of, say, a patient that has pain, back pain maybe, how is it affecting? L stands for, how is it affecting their daily living? Is it debilitating? Does it mean there's things they can't do? What sort of ideas do they have? They may not, you might say, have you tried paracetamol? They may have an idea that paracetamol's not very good. It's just something that you can buy at the counter, everybody uses. It's not really going to help with their back pain. They need something stronger. Establishing what their concerns are. What's their concerns about a particular medication? Are they worried about side effects? What are their expectations? What do they hope to get out of it? Do they want the pain to be completely gone, or do they realize, say, if they know they're waiting for an operation, they just want something to help control it, or so that they can do certain things or ease the pain? How do they feel? What are their feelings about a particular thing? So that's another one that you can use. Another method to be aware of is cognitive behavioral therapy. It's another powerful technique like health coaching that some practitioners use, and it's basically looking at people's thought processes and what's the thinking behind their behavior and investigating that and helping them to understand that. So that might be, what are their thoughts and processes behind why they don't take a particular medication, and addressing that so that they are able to take that medication. So what I would like you to do now is to pause, have a recap of the things that we've learned so far. There's a video that I would like you to watch. There's a link to it here, but there's a link in the Blackboard as well, warfarin video. What I would like you to do is play the video, and then first just don't look at the screen, just look away or close your eyes and listen to the consultation the pharmacist is having with the patient about warfarin. And then at the end, I want you to watch it again, and then you'll see the patient's thought processes. And that gives you an idea of the importance of trying to find out what patients' thought processes are to help them take their medication. So if you want to stop here now and look at that video, and then we'll come back in part 2 and discuss some more. Thank you.